Hello, everyone. Welcome to today's show of Public Health and Real Life. This is in collaboration with UWall Foundation, and we are doing the series on maternal and women's health. And UWall is the mission of UWall is to help meet the unmet healthcare and wellness needs of underprivileged societies through medical outreach, health education, clean water, hygiene, sanitation, and other healthcare sustainability projects. And for us, Public Health in Real Life has been established as a YouTube channel to promote public health topics, celebrate unsung heroes in the field, as well as to inspire the next generation of public health professionals and leaders. In today's topic, we are going to highlight menstrual health and hygiene. And at the top of the program, I wanted to highlight firstly about the role of men in menstruation. And I'm going to quote a recent blog post from Siddharth Henry. It said, men can advocate for a period positive environment and ensure that there is a safe space created for menstruators. In a patriarchal society, like in most low and middle income countries, where menstruation is stigmatized to its core, it becomes of utmost importance that men start talking about periods and deconstruct the taboos and stigmas that exist around them. Buying sanitary pads from the medical shop, talking about periods with their wife, daughter, colleague, and peers, and ensuring that the right kind of supports provided to them is the bare minimum that they can do. With this, it is also important to know when to speak, and whenever you speak, it should not be in a condescending manner. So, with that, I'm privileged to talk about this topic, and we have two esteemed guests um, in our channel today. Before that, we'll give a quick intro to menstrual health and hygiene um, from the World Bank Group. It says that mental health and hygiene is essential to the well being of and empowerment of women and adults and girls. On any given day, more than 300 million women worldwide are menstruating. In total, an estimated 500 million lack access to menstrual products and adequate facilities for menstrual hygiene management, which is also called as MHM. They lack the proper wash, that is, water sanitation, hygiene facilities, affordable and appropriate menstrual hygiene products and materials, and also proper education as well. So, in that, we are privileged to welcome two guests. My first guest is Mr. Ivan Tamba. Mr. Ivan Tamba, let's add him here. Mr. Ivan Tamba serves as the founder and executive director of the Okra Network, a nonprofit organization dedicated to enhancing the visibility of African organizations and fostering cross cultural connections by implementing impactful solutions to address local challenges. Hailing from Liberia and currently residing in Arizona, Ivan brings a diverse experience spanning multiple continents. His mission is to revolutionize the landscape of nonprofit work in Africa, driven by passion for innovation and a commitment to transformative change. Ivan, welcome to the program.
Thank you very much for having me, Ashwin.
Okay, our next guest is Rachel, who's a Rotarian and a social worker, holds a master's in arts and social sector planning and management, and a bachelor's in social sciences from the Makerere University in Kampala. With over 8 years of community service experience, she has collaborated with various organizations on youth and women projects, focusing on health empowerment. As the program officer with the Okra Network, she empowers young people in Kampala with social skills, including menstrual health, ICT, and environmental protection for employability and social development. She advocates that skilled youth are assets for creating healthier community. So, as we and welcome to the program, Rachel.
Thank you
Right.
very much for having me.
Thank you. So, would like to start. Of course, I gave a little bit of introduction from what we see in the literature, but Can we just start the program with some of the challenges you see in low resource settings that women face regarding menstrual health, and what the Amani project and the Okra network is doing to address some of that? So, first with challenges and then the introduction to the Okra network.
I can begin.
Uh,
Or actually, Rachel, go ahead.
Thank you very
Go ahead,
much.
Rachel.
Uh, Thank you very much. Maybe before we could continue with the challenges, I would like to stress more about the meaning of menstrual hygiene and health, because usually we explain it in a broader picture, but it could easily mean the ability to access a menstrual management product that is clean, uh, that is uh, that is clean, that can absorb or collect blood, and is able to change this product in privacy for the period of accessing clean water and soap. So when we talk about menstrual health, we are looking at three things in particular. We are looking at a product that is able to absorb the blood. And then we are looking at having the right privacy to change this product after maybe a certain period of time. And then we are looking at accessing the water, clean and safe water to wash this product, or maybe a disposal place for this product after use. So we are menstrual hygiene is basically about a product and disposal and water. So most of the challenges that we have experienced here in Uganda with our women is lack of sanitation at schools and in communities. Many girls are staying home during their periods or dropping out altogether when they start menstruating because they do not have sanitary areas where they can privately change their material. And then reproductive and sexual health education are not a priority in my country, not even in my country, but even in my homes. Mm. Our homes, our parents do not talk about this reproductive and sex education freely. I can give an example of myself. My mother has never told me anything about menstruation or anything about sex. And for a child or a girl to know about menstruation, they have to start with reproduction. And then after that, you tell them about sex. And then menstruation also comes in because they all go hand in hand. But these are taboos. These are topics that you don't easily find in our communities being said out because they are associated with the stigma, health problems, and teenage pregnancies. Then we also don't find conversations at the grassroots. These areas do not easily have enough conversations unless someone has got pregnant or soiled their dress or clothes. That's when you hear someone saying, "Hey, you're menstruating." But in other conversations, it's never said. And the highest challenge is the accessibility to pads or sanitary product. Yeah, it's not easily accessible for most of the girls and women in our local communities here. And those that can easily access them are the elite group. Those that have gone to school are the ones that can access those products. You would be surprised if you move to some of the schools and communities we've been to, and when you show them a sanitary pad, they are like, "Wow, what is this?" They are so surprised. They didn't even know it exists. And all these and many, many challenges have separated boys and girls from such topics, and we are here to break that silence and speak about menstrual health and hygiene to our communities so that we can overcome these challenges. Maybe I would also have forgotten something that was so intriguing: the use of local herbs. Yes, our communities are still so traditional that they still use local herbs to reduce on the menstrual days because they cannot afford sanitary products for maybe an example, if a girl is menstruating for 5 days, they will take local herbs to reduce the days to 3 because they do not have money to buy a whole packet of pads. So all these challenges are in our communities, and we have seen them firsthand, and we have also at some point experienced them before we got to know this whole information about menstrual health and hygiene. And as the Okra Network, we are working together with other local organizations on the ground to talk about menstrual health and hygiene and see how we can help to overcome these challenges one at a time. Uh, Surprisingly, our government here provides porridge, food for children going to school every term. You're entitled to a cup of porridge,
Mhm.
and they cannot do the same for the pads or sanitary towels. So we are trying to see how can we talk to our local authorities to advocate for an extra pad for a school going child. Hmm? If you can offer a cup of porridge, then you are able to offer a pad once a
Right.
month. That's very cheap. Yeah. And then also another issue I would want to stress is that menstruation is not a medical matter. It is not a medical matter, much as it may end up having medical issues, especially if infections are involved. But it is not a medical matter, it is a natural thing. And every girl or woman has to go through it. And that's why the Okra Network, in partnership with other organizations in Uganda, we are working very hard to see that such information and education reaches the grassroots woman or man or community.
Right.
Uh, should I continue with the challenges? Yes. So the how we are addressing them? Yes. So we are addressing these challenges by working with the community. We want a community-driven initiative where we do community needs assessment. If a community member is involved in identifying the gaps, the challenges, then it is easy for us to introduce a product that they will easily accept and help to take ownership. And that
Right.
automatically will lead to sustainability of our Amani project. And then also we are working on the involvement of multi-sectoral approach of different stakeholders like the schools and the education sector, the health. The education, we have so far worked with about 3 schools, no, 4 schools where over 500 students have been trained in the
Okay.
making of reusable sanitary pads. That was our first project, and we are hoping that we are going to continue with it throughout the next year. So we are teaching the school children in secondary school specifically. I don't know what it equates to. I think that's high school on your side. So we are
Right.
teaching them on the how to make reusable sanitary pads. Each
Okay.
girl makes a pad, and when they go back to their homes and communities, they are able to train their sisters and mothers and brothers. Then we are involving the health sector. We have what we call the village health teams, like extension workers of the doctors and nurses. So we are using them, we are involving them in this project so that they also help us to continue the project when we leave ground. And then we also, of course, we cannot forget the government itself and the local authority because we need their security and approval and their involvement because this is a health matter that affects the country after. So we involve them in different ways. And then of the business community. We are involving the business community because this is a fresh ground for business. If the
Right.
pads or the sanitary towels are few, then it means a businessman can now start bringing in the product into the country or making the product themselves, which will earn them more money and a lot more. Then we also have the WASH, the water and sanitation project that the government put in place for all schools to improve on hand washing and hygiene. So we are integrating it into our Amani project so that we encourage good sanitation and hygiene. Wash your hands after changing your product. Then how do you dispose of your product? And then
Right.
how do you clean the product in case you're using the menstrual cup or the reusable sanitary pad? So we encourage them to take on the wash project and the wash programs to improve on the community and personal hygiene. Uh, I think that's all. That's what we are doing for now.
This is No, this is a very well put together list of challenges, Rachel, and definitely it's very difficult, especially to change the cultural views, or especially as you mentioned about the home. Everything starts with the home and how difficult it is, and you put together the especially with even with the schools and with the when they're able to provide food to the children, they can also provide pads, and how the local communities are taking ownership in coming up with their own pads, and how we can collaborate with the business communities. Um, I want to just bring in Ivan to the conversation. Ivan, you're seeing the both worlds, the West and what's happening in low and middle income countries. And one easy thing that people will say is, okay, let's collect a lot of pads and send it to countries like Uganda. That will solve the problem. That is one of the aspects they can bring in. Another thing is, let's do a private public private partnership with companies that manufacture pads, and then let's do that partnership with the Ugandan government. So those are some easy solutions. People will automatically bring it to you. But what are some of the challenges you're seeing in terms of other countries' involvement, and other donors involved, people who are really interested, genuinely interested, to reaching those grassroots level impact?
Yeah. So again, I do want to say thank you to Rachel for those explanations. But I think one of the big issues that we have with menstrual health in general is it's kind of multifaceted, right? So in the U.S., the issue is not access. The issue is oftentimes um, providing the products at a lower cost. For example, I think one of the issues we see in some schools or some areas is that people are willing to hand out condoms, but they're not willing to hand out tampons for free.
Right, right,
But
Mm.
so for the U.S. it's not accessibility, but for Uganda and many other African countries, it is accessibility, and then it's cost, and then it's stigma. So it's all these things that come together. And one of the things that we got to so I got to go to Uganda in October, and
okay,
and one of the things that I saw when we were sort of doing our assessments was that people genuinely wanted a solution. It wasn't like people stood there and were just you know wanting whatever things that came to their heads. It was literally like, we want things to take care of our menstrual health. You
right,
know, and so what we do at the Okra Network is we try to come up with these ideas that it's not a brand new idea. Menstrual pads, menstrual cups, these aren't brand new ideas,
correct,
but these are
yeah,
instrumental to their everyday well-being. And so our goal is to be able to partner with local organizations and see if we can implement these there. I think that's something that we're trying to sort of bridge when it comes to how nonprofit work works in these communities, because
right,
some of these larger organizations, they receive a lot of funds, they receive a lot of resources,
yeah,
um, and I can't say that they're not impactful, because at the end of the day, if one person is impacted, then that's already a lot
correct,
more
correct.
powerful, right?
But having
But
the grassroots level visibility is important. And go ahead, go ahead.
exactly, no, exactly, no, you're exactly right. And um, you know, we could rally around, get as much money as possible, which is
Right.
another issue. But we can do that and then go implement projects directly and say, you know what, we did a great job, and just leave. But the problem is
Right.
that there are active organizations in these communities of
Right.
individuals who are from these communities, who live in these communities, who work and everything, right? Their
Right.
entire life revolves around maintaining their lives in those communities. And so what we want to do is we want to be able to uplift them. We want to be able to give them sort of the microphone, and we want to assist any way that we can. So it could either be resource gathering, it could be
Right.
visibility through our through social media, through websites, or it could be through networking. So partnering with Yuval was an opportunity for us to see what the two of us could do with one of the organizations that we're partnered
Okay.
with in the western part of Uganda, in Fort Portal, the Change Society Needs. And so when we met with Change Society Needs, we asked, hey, we've received all these cups from Yuval Foundation to sort of work within our menstrual health initiatives, and our team got together and said, I think these menstrual cups are great, but
Right.
they may not work in our high school setting, and that's another conversation.
Sure.
Cups are not going to be they're very stigmatized for younger girls.
Right.
So we said, okay, well, who do you know in the community that may need help? And then they go, oh, there's a lot of communities that need help, but specifically there's a demographic that's really at risk.
Right.
And so we went to go visit this village. And as we're doing our needs assessment, many of the women there were saying, like, they were just accepting. They were so receptive of the idea that their menstrual hygiene, they were going to have a solution for that. And so
Right.
that's what we do, right? So we want to identify organizations in Africa, try to uplift them, and then
Right.
make sure that they can key in on areas. And then through that, we want to be able to work with different organizations that we can or partnered organizations to reach those demographics. Um,
Right.
and I think that's at least from my time working in the nonprofit space, or even in the governmental space. I was a Peace Corps volunteer for 2 years in
Okay.
Ethiopia, and
Okay.
yeah, and I there's a lot of great things that come out of that, but there were also a lot of questions that I had with how projects were implemented, as well as sort of the sustainability of our initiatives and our sort of our overall purpose in being there,
Right.
and with that being said, I wanted to make sure that those things that I identified could be remedied. And one of those big things is how you utilize the local communities, how you utilize
That won't.
their voices.
Right.
Yeah. Mm.
So that makes
And
sense. And go ahead.
sorry, I missed. What were you saying?
No, I was like, I was just saying, yeah, these are some really um, grappling issues that you would face when you're actually in the ground. And I really like the way you put it in terms of understanding, hearing their voices, coming up with their solutions rather than just pushing our own solutions on them. And in that, Rachel, my question for you is, whenever you go and talk to the communities regarding the cups or pads, um, have you seen maybe kind of disinterest from the community to use um, foreign products, and that it's not going to be sustainable? Rather, we will use we can come up with the local solutions. How receptive are they to coming up with local solutions? Because you said, there is already difficulty in the home itself with those conversations. So if there is no if there might not be interest in accepting foreign practices, what local practices are being supported, or harmless local practices rather than harmful ones?
Uh, Thank you very much. Thank you very much for the question. Uh, the local products that we are encouraging them to use. First of all, menstrual cups are acceptable. They have been accepted by the community. Like Ivan has mentioned, the adults have accepted them because for you to use a menstrual cup, you must have access to clean water. And
Right.
the community where we did our pilot study, it's on a mountain, it's on a hill, so they have access to clean water, clean running water, and they accepted the menstrual cups wholeheartedly. But with a school going children or girls, the menstrual cup is still a challenge because there is still a stigma and I don't know how to put it, but I would say taboo associated with it
Right. Right.
because they think a menstrual cup leads to
Right.
early menopause.
Right. Right. Right.
It
Right.
leads,
Okay. Got
yes,
it.
so they think it leads to early menopause because for a young girl who has not yet given birth, they feel that it will affect their reproductive system. That's why it
Right.
is not yet acceptable in the school going children. But as the Amani project, we are now using the reusable sanitary pads. We are teaching the school going children how to make reusable sanitary pads. And this sanitary pad can be used for over 2 years if it is well maintained and well kept because you just need to sew it whenever it gets a few patches. So it can be used for a long time. And we after the training, each girl is able to go back with a pad
Right.
and extra material to make more faux pads for themselves at home to perfect the skill. Also, to encourage them, we are bringing the boys on board. We want the
Right.
boys to participate. Mm.
Right.
So the boys are encouraged and they also make the product which they are able to give to their sisters and mothers at home because you do not expect a girl to have two pads and when the mother is in her period she has to pass on one pad. So we emphasize passing on the skill to the mother and the people at home so that in the long run they have enough pads for use and maybe they can choose to make more products for sale as a source of income.
Right.
Then also the menstrual cups have also been acceptable because they are environmentally friendly.
Right.
They can the cups can be used for over 8 years.
Right.
So
Oh, wow.
they
Okay.
are environmentally friendly. They do not affect the environment because you just use and keep for the next month. And
Right.
they are sustainable. You don't buy every now and then.
Right.
So the Amani project, together with the reusable pad project, they are doing very well because the communities have really accepted them. Yeah, that's what I can say for now.
That's a good. Yeah. So one thing I want to come back to, maybe even you're also welcome to chime in on this, along with Rachel as well. So you spoke about the role of men and boys. So that I see as a big deal, whether it is male teachers or male politicians or male community leaders. They have a voice. They have a voice in the home, they have a voice in the society, all that. So one aspect, Ivan, from your perspective, can you discuss a little bit of, as a man, have you been successful, and what are some still ongoing gaps that you face when you talk about what is perceived as a female matter to males in communities, and what are some of the definitely there will be challenges, but let's talk about where you have found common ground and where you have found some solutions with talking to men.
Yeah, so I think growing up as a young man in America, the issue of menstrual or menstruation in general is it's a bit trivial. You know, you could grow up and never really realize that you've interacted with someone who's menstruated if you don't have if you don't understand sort of what women go through. I do remember my first moment of wait a second, I'm different than girls was in middle school. We're sitting in math class, and there was a girl, and she was behaving a little differently that day,
Okay.
and I was like, "Hey, are you okay?" And she's not really saying anything, and then I look at her chair, and there's like blood on her chair, and it's kind of dried because she's been sitting on it, and I remember I think one of her friends gave her her sweatshirt, and she raised her hand. She asked if she could go to the bathroom, and she went to the bathroom. And one of our classmates pointed at the chair and sort of made a big deal about it. But none of us boys understood what had happened.
Right.
We had no idea, right?
Right.
And I remember going home and telling my mom that story, and my mom saying something along the line of, "Oh, that's her time of the month," and I didn't understand what that meant,
Right.
right? And then we had health class in high school, and I think that opened up a little bit. But flash forward to about 2019, I'm in Ethiopia. I'm working
Yeah.
as an English specialist, and one of my students is she's having a really rough time, and then she starts getting dehydrated, and again, it kind of goes with sort of cultural practices. Well, we're outside, and there's a bunch of girls around her, and then the administration, they're all men. They come over, and I don't know why they didn't ask for a female teacher, but they all come over and they look at her, and someone yells, "Get a Bible." And I was like, wait, why? And so they were going to recite some things to her, and the girl was Muslim, so her
Wow.
Muslim friends were like, "Don't do that." And this whole
Yeah.
time, I'm looking at her, and I noticed that she's dehydrated. And then I thought quickly, and I was like, "Oh, she is probably menstruating right now."
Right.
Right. And so water wasn't, you could access water on our campus, but people weren't just going to drink water. Like, we didn't have a drinking fountain like we do in America in most schools. And so, but I do realize that during menstruation, dehydration is increased. And so I told one of the girls to go get water. She brings water, and I'm telling her to give it to me. And she goes, "No, no, no." One of the teachers told her to take the water and splash it in the girl's face.
Oh, wow.
So again, I was like, "Oh, this is not good."
Right.
And so that day or the next day, I did a small lesson on menstruation, and I got it approved by the director.
Okay.
But I realized that, especially in these sorts of conversations, that if the conversation is started in this way by a man, the boys in the classroom, sorry about that, the boys in the classroom,
Yeah.
they'll listen,
Right.
and it's not to say that they wouldn't listen if it was a woman explaining it, but there's sort of that embarrassment or that shame that happens when the boys in that moment, they're feeling like, "Oh, this is just a girl issue." But if it's a man speaking, it does allow them a little bit of we can connect a little bit in that moment.
Absolutely.
And so in the context of Uganda and the projects that we've ran, it's amazing to see how many boys are willing to be there. How many boys are cutting cloth, and how many boys are involving themselves with the girls.
Amazing.
And it's amazing. And it isn't this like ha 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 situation, because part of menstrual health education is explaining to each boy that this does impact them. Okay? This does in fact impact them.
Absolutely.
Whether it's their sisters or their mothers or their friends, it's there.
Right.
right? And so the more I believe the more males that were able to get involved in these projects as well, the more socially accepted it becomes, and the less shame there is. I'm an educator,
Right.
and I teach high school and middle school. But one of my middle schoolers a couple months ago, you just know, and so she, after lunchtime, I don't allow the middle schoolers to go to the bathroom because they just had lunch. That's their time. Don't
Yeah.
use my time.
Right.
And
Right.
so her raising her hand let me know that, okay, something is urgent. And so I let her go. And then, of course, one of the boys goes, "You must favorite girls because you won't let any of us boys
Right.
go,"
Right.
you know? so so I use that moment to ask the class, how many of you are familiar with the time of the month? And
Right.
of course, they're like, "What?" I said,
Right.
"Okay."
Yeah.
And we had a little small conversation about it, and I think that really did help some of them
That's amazing.
understand that this is something that again, it's important, and it does in fact impact them whether they realize it or not. So all that to say, we have to do better, and we have to do better. Excuse
Right.
me, we have to do better by being able to um, not only have the conversation, but sometimes lead the conversation when there isn't an adult woman in the room to navigate that.
It's a big deal. No, definitely very well put in terms of how the role of men can change people's perspective, especially boys' perspective in a school setting. Rachel, I just want to touch a little bit of men's role in the community and how you have seen um, that improve. But before then, I want to just bring in a comment, a question, I think, from the chat. Let's first address the chat and then we can go to my question. The question I got here is interesting from Adiola. Interesting conversation. Are public or government institutions considering introducing reproductive and sexual health education to their curriculum?
Thank you very much for that question, Adir. Uh, yes, our government has, for the past, I think, since 2016, they've been talking about integrating reproductive and sexual health into our education curriculum, but that's lagging. It has not been effected.
Yeah.
I think mainly because our curriculum keeps changing. They are either adding in something that is not connected to sexual education or adding something related to agriculture. So specifically, menstrual hygiene and sanitation are not integrated. We are leaving it for the primary school children. For now, it's still taught at the primary school level where we have a primary health care as, as a subject that is not even given for credit units, if I would say. So our government has not really done much to integrate that into our curriculum. But we are advocating for that. We are hoping that once we bring all the stakeholders on board, especially the government, and because through its WASH, the Water and Sanitation Project, they had that was under World Health Organization. They had suggested to provide infrastructure where girls can go and change
Right.
there during that time, and also put up hand washing stations and water tanks in different schools and community centers. But that has not been done so far because the community was not involved in that project. So
Right.
it is still, the uptake is still very low. But we are hopeful that once our project takes base and gains more circulation and visibility, then we can talk to the educational sector to bring health education to our people.
That's a
Yes.
big deal. And so, really good question, also, Adiola. And thanks for
If I
that.
could, if I could, if I could add to that
Go ahead.
too, I think one of the instrumental parts of having these grassroots organizations is that we're able to go to local schools and say, hey, here is an idea. Do you have time?
Right,
There's between testing and between school enrollment and everything,
right.
we know that things are very time sensitive. But when we go to them and we say, hey, director, we have this project, we can provide X, Y, and Z, just give us time. We have found that every single one of these directors is extremely thrilled. And I believe after our first project implementation, we received a lot of pretty good feedback as well as a lot of interests to run these programs. So me specifically, I think we have to have government involvement, but I don't. I can be a bit impatient about that sometimes because we all know that to get through government, um, there are a lot of hurdles that you have to jump, and even when those hurdles are jumped, now you have to play the waiting game. So it may not be this year, it may not be next year, it'll be 2 years from now.
Yeah.
Well, unfortunately, 2 years from now means that we've already graduated two classes of students
Right, right,
who will
right,
not be educated on that. And to me, that's extremely problematic because what we're saying is that those two did not matter as much as
right.
the others, right? All because of time. And I know with the interest of time, well, you have organizations in the country, many, many organizations in these countries who are willing to take up these projects and who are willing to, I mean, I think in a perfect world, you would run these projects in the beginning of the semester and then at the end of the school year, and then you'd allow these nonprofits, allow them to guide it. um, and I really do believe that would take a lot of strain off of the governments. But if we give the rein all to the government,
Yeah.
um,
I think not,
they're
not,
busy.
yeah,
Exactly. And for lack of better words, they're busy. They might be focused on things that they believe are more
right.
prioritizing. But ideal, that's a great question. That's a great question, and I think we can really do a lot more there than we like to believe.
No, fantastic response, and also about the role of non-profits in these settings. And Rachel, you spoke about three things, right? Product, privacy, water. So, water facilities and privacy, those two really, a good part of it really has to happen through government. Product is a product and education. Those two is something that non-profits can effectively provide. And also probably soap. I think soap is also something we can grassroots level organizations can provide. Um, and in terms of privacy and water, while it is already, even girls education itself is being reconsidered in low and middle income countries. How much do you see girls dropping out because of the lack of menstrual hygiene products?
Thank you very much. Uh, Maybe I forgot to mention that the rate at which girls in the local communities here in Uganda are dropping out of school is is very high. For example, during COVID-19 time, lockdown, we had over 70% of the children, of the girls, drop out of school to get married. And that gives us a high number of teenage pregnancies. And all this is associated with lack of pads because an example, especially in the secondary school going girls, was because they did not have money. Their parents have to choose between buying food or buying a pad.
Yeah,
And a pad costs around between $7 and $20. So that's a lot of money for a low income earner here in our communities. So you find that a girl who gets maybe a well-off man to buy them a pad can easily go for marriage at a young age, below 15 years,
Yeah.
just to be given that product. Yeah, so
Yeah.
the rate is very high, and the teenage pregnancies are also very high in the community.
That's definitely a bit of a disturbing fact there. Earlier, when you gave your introduction, Rachel, you spoke about local herbs. Is that like traditional medicines, and is that like traditional products that girls are taking to? Is it like a birth control, or what is that herbs do?
Uh, the herbs are a local product.
Okay.
It's not. I don't think it's even a product, but you just go to the garden and pick leaves, squeeze them in water, and drink. I
Okay.
don't think that's a product, but that's a
Right.
concoction
Right.
that
Right.
we make.
Right. Post. Okay.
Yes, so the concoction is it's a traditional medicine that our great grandparents used to take during their time of the month. And these girls in the local communities, because they have low levels of education, and some of them do not have basic education about menstrual health, so they are given these herbs to take, to
Right.
drink.
Right.
And there is something that that is very common in our community.
Right.
If you're a new girl before you start menstruation, your parent, especially our parents who did not go to school or who have no access to this information, tells you, forewarns you that if you see your first blood, make sure you tell me.
Right. Right.
So
Right.
once they tell you to go to a unfinished building with bricks
Wow.
and then count bricks. Yes, you're asked to count the bricks, and they specifically tell you do not count past 4 or 5 bricks. So
Okay.
it's a belief that we have that once you
Okay.
count 1, 2, 3, those are the number of days that your menstrual period will last.
Right. Right.
And for those that are very quick at counting, you end up counting up to 5 or 6 or 7,
Right.
and that's when the herbs come in to reduce on that days in
Right.
the long run. Yeah, so
Right.
the herbs are something that has been there
Yeah.
for a long time.
Bottom line is that there is some cultural beliefs also to be dispelled. That is widely accepted as something that works for the local community. And this was a really great conversation, Ivan and Rachel. We wanted to talk a little bit about the future for Amani project, and what are some strides you're making. That's if you can share one or two positive areas that we can further target, and how does future look like for Amani project? What areas will you be focusing on?
So, I think this kind of goes with the question that Ideola asked about what have the greatest benefits of collaborating with nonprofits organizations such as UVOL.
Yes.
Um, yeah. So, in the future, I really want to be able to, or we really want to be able um, to gather more resources. We ran into a bit of a funding issue, and with that came some limitations because there are some things that makes a project kind of just even more impactful outside of just having just collecting the bodies and giving the information. Um, so what that ends up doing when we collaborate with different organizations is, we put a list out of resources that we have, resources they have, and
Yeah.
see what we can use to sort of reduce the burden on one organization or the other organization. Um, and so with Yuval, they came in, they provided the cups. So that obviously was instrumental right there.
Yeah.
The menstrual pads in itself is something that we want to implement for this project again next year. But the cups are great. Pads would be great. We do want to implement a water and sanitation education portion of this. And because that, I mean, one of the things that the women kept asking for were soaps. And
Right.
so if we could collaborate with an organization
Absolutely.
that is able to make reusable soaps, not reusable soaps, sorry, environmentally friendly soaps.
Right.
Reusable soaps would be awesome. um, but yeah, I think that would be extremely impactful as well.
Yeah.
You know, and she asked, how do you hope to collaborate with them in the future? Yeah, so through social media and through sort of these sorts of conversations that we're having, it will allow others to say, hey, you know, we can't do that much, but here's what we can do.
Yeah.
And you know, we're gonna kind of go back in our drawing board to see, you know, based off of our projects from the past year, what can be done, what can be reduced, where can costs be allocated differently.
Right.
And again, I kind of, I don't want to throw major nonprofits under the bus,
Right.
but um, I've seen, and Rachel has as well, we've seen a lot of projects be run off of a lot of funds. And
Right.
we look and go, where did the rest of that money go? Because that's a
Right.
lot for that project, you know. So I think that is something that we can also be very, very impactful in, is being able to meet with some of these larger stakeholders and say, hey, you know, we identified you had this project run for X amount of days. Maybe we can divide different resources for different areas and so forth.
Right.
But we would love to partner with larger organizations. At the moment, we're really focused on the grassroots to really
Right.
see what we can help. But we do know that these major resources and items come from some of these bigger organizations. So that collaboration is going to come in hopefully sooner than later.
How can people reach out to you?
So, go ahead, Rachel.
No, you go ahead, Ivan.
Okay. So people can reach out to us through email, either at info at the Okra Network. If they want to reach out to us directly. My email is itamba at theokranetwork.org. But we're very responsive on our social media platforms. So whether that's LinkedIn,
Okay.
Facebook, Instagram, Twitter, you know, we're live on all the major platforms. You know, we really want to be able to, you know, we at the moment, excuse me, at the moment, I think one of the larger demographics that reach out to us, or sorry, sectors, the education sector. The education sector, you know, education is seen extremely positive in Africa for the most part. And
Yeah.
so people are always looking to find a way to implement better educational products, better educational practices. And so we get a lot of emails from those groups. We have had different organizations reach out to us about pads. Now, some of those pads come with high costs, and that's not sustainable. But we're welcoming to literally anyone that's doing work, and we just want to continue that, and we want to continue that
Definitely.
sort of conversation.
Yeah, this has been an enlightening conversation, Ivan, and work Rachel and you are doing a fantastic job, and especially to the point you mentioned about the large versus small non-profit organizations. The non-profit organizations that are working in the grassroots level, they are able to bring some disruptive innovations that larger organizations may not be able to do sometimes. So those are some advantages of supporting directly the local organizations, and those who are especially listening to the local voices, who are collaborating with the local voices and coming up with solutions with the people, for the people, by the people. And in that, really, we want to highlight also about Rachel's point before about access to menstrual health management products and how it might affect girls' dropout rate from the schools. It might look like a very minor issue, but it's not a minor issue. It's a major issue. It affects girls. It affects how girls see themselves, how girls approach education, how girls approach sitting together with boys and studying, and coming up in their own studies, and accomplishing things in their lives. And as Rachel also mentioned about teenage pregnancies, a well-educated girl is that there's not going to be the teenage pregnancy. When there's teenage pregnancy, then there is also child born before the mother and father knows how to raise the child, and then it becomes like a cycle. So this is the MHM management products, providing privacy to girls and women, water facilities. These are all some of the key aspects that public health field needs to focus on. There is more need for research, funding, work to be done, and people like Ivan and Rachel are doing a fantastic job. It's up to us to support communities like the Okra Network to stop and to build awareness and to build awareness and provide access to menstrual health and hygiene products. So, with that, I want to thank again Ivan and Rachel for this fantastic conversation, and thanks to everyone who has viewed this program. And look, we will see you with another topic next time. And until then, I'm Ashwin Kadambi, and this is Public Health and Real Life. Thank you.
Thank you.